Hello, my name is Melissa Hesselmeyer and I am the Health Sciences Librarian with Lone Star Montgomery. I am here to provide research support to students and faculty in the health sciences. Part of that research support involves me assisting you with your research assignments and understanding how to locate evidence-based research. Evidence-based medicine is the integration of best research evidence with clinical expertise and patient values. Healthcare literature with clinically applicable findings is published at a rate that is impossible for individual clinicians to keep up with. Evidence-based practice tools and methods make it faster and easier to find the best evidence, especially at the point of care where it matters most. Let's review the EBP process. Step 1. Ask. In this step, you will develop a focused clinical question by using the PICO framework. Step 2. Acquire. In this step, you will select appropriate resources and search the literature for evidence. Step 3. Appraise. When appraising evidence, you are critically reviewing evidence for validity and applicability. Step 4. Apply. Applying our evidence refers to implementing the findings with your patient. Step 5. Assess. Lastly, we assess the implementation by evaluating the results. We'll focus on the ask and acquire steps in the EBP process in this video. In step 1 of the EBP process, we want to ask a clinical question. We do this by using the PICO framework to develop a focused clinical question. The elements of PICO are P, which stands for patient, population, or problem, I, which stands for intervention, prognostic factor, or exposure, C, which stands for comparative intervention or exposure, if appropriate, and O, which stands for outcome you would like to measure or achieve. Let's assume I've read a case study and identified the elements needed to organize a well-built, answerable clinical question. For patient, population, or problem, I've identified a premenopausal female with estrogen receptor-positive breast cancer. The intervention identified is the medication tamoxifen. I want to compare the intervention to those premenopausal patients who get no hormonal therapy to see if there is a decreased risk of a breast cancer reoccurrence. Based on the identified PICO elements, I am able to build a clinical question. In a premenopausal female with estrogen receptor-positive or ER+ breast cancer, does the use of tamoxifen compared to no hormonal therapy decrease the risk of recurrence of breast cancer? After formulating the clinical question and identifying the PICO elements, I will need to find relevant evidence by selecting appropriate resources and searching the literature for that evidence. There are a few different types of evidence to consider: filtered and unfiltered. There are generally 3 categories of resources to find evidence, and they each provide background information on the topic, filtered resources related to the topic, and unfiltered resources related to the topic. First, let's take a look at the difference between popular versus scholarly resources. Popular sources provide information on various topics, current events, or popular culture. These sources are authored by journalists or professional writers and aim to inform or entertain a general audience. This type of publication might be edited for spelling, grammar, organization, etc., but they are not peer-reviewed. An example of a popular source would be something like Time magazine. But scholarly sources are written works that have been peer-reviewed or refereed. The terms peer-reviewed and refereed are interchangeable and refer to a process of evaluation. Experts or peers in the subject matter evaluate or review or referee the work and deem it deserving or undeserving of publication. The evaluation measures the authority, accuracy, and relevancy of the work to ensure high quality. Scholarly sources are widely considered the most reliable sources of information, and an example of a scholarly source would be the Journal of the American Medical Association. We also need to consider primary and secondary sources, and this is especially important in evidence-based research. In general, when we talk about primary and secondary sources, we're talking about the author's relationship to the observation or experience. It is either direct or indirect. But in EBP, when we talk about primary and secondary literature, the focus is less on the authorship and more on the level of evaluation. Secondary research is filtered and pre-appraised, meaning that clinical experts and subject specialists have posed a question and then synthesized evidence to state conclusions based on available research. These resources are helpful because the literature has been searched and results evaluated to provide only those studies that are of higher quality and are regularly updated so that the evidence accessed is current. primary research is unfiltered and it has not been evaluated or pre-appraised. It is helpful to use when a filtered resource does not cover a topic or you want to see what is new since the filtered source was last updated. Secondary literature synthesizes, filters, and evaluates the primary literature. Evidence is graded for quality based on its design. So some studies are designed to reduce the incidence of bias, and these studies or evidence types appear near and at the top of the evidence pyramid. So measures like randomization and blinding help to eliminate bias. Other study designs are more susceptible to bias and appear near the bottom of this pyramid. The different types of evidence will be found in different resources. You won't always find the highest level of information for each clinical question. Now that we understand a little bit more about evidence types and formats, let's review some of the EBP resources that you can access through the library. Several databases that allow you to search for filtered evidence or secondary research include CINAHL, Nursing and Allied Health, our TRIP database, and PubMed. We'll look at these more in depth in a separate video. You can also search for unfiltered evidence or primary research in CINAHL, Medline, PubMed, and HealthSource. So let's put the two steps that we covered together. We understand the EBP process and some key concepts, and we've got some resources and tools in mind, so now we can begin our research by determining what keywords to use. Let's go back to my original clinical question and PICO identification. In a premenopausal female with estrogen receptor positive or ER plus breast cancer, does the use of tamoxifen compared to no hormonal therapy decrease the risk of recurrence of breast cancer? I can use the PICO elements as keywords when searching the databases. You will often want to select the two most important concepts from PICO for your search. From my clinical question, the patient and intervention seem to be the most important concepts, so I will use those as my keywords. In research databases, you'll want to use multiple keywords connected by Boolean operators for a more successful focused search. Let's start with AND. When we use AND between two keywords, it tells the database to bring back results that include all search terms in the record. This will help narrow our search results. OR is most often used between synonyms. For example, I may be focusing my research on estrogen receptor positive breast cancer, but researchers and clinicians may refer to it as ER plus in their study. Utilizing OR between the keywords estrogen receptor positive and ER plus ensures that I am getting all of the research that is covering that particular group. OR will expand our search results. NOT is the last of the Boolean operators, and it is used to exclude keywords from our search results. We can use this if we have enough research on a particular topic, or we want to focus our research more. In this example, we want articles on estrogen receptor positive and tamoxifen, but not Avista, which is another medication used to treat ER positive breast cancer. So NOT will narrow our search results. Now that we have our keywords identified and understand how Boolean operators work, check out the video on finding evidence-based research in the databases. If you're having trouble selecting databases for your topic, navigating within that database, or more generally finding resources, the librarians are here to help.